Alright, hi everyone. I got to research Cruetzfeldt-Jakob disease. So, what is it? Mainly, it is a rare, degenerative, and always fatal brain disease. 1 in 1 million people worldwide are diagnosed with Cruetzfeldt-Jakob disease every year. So it's very rare, but it tends to develop around age 60, although one variant of it can develop in the teens into 20s age, but normally older people have it. It's sometimes considered by the general public human mad cow disease because there's one small variant of it, the disease that came from people eating contaminated beef, and the beef had mad cow disease, so you may know it as that. Some key symptoms that kind of set this apart is its rapid mental deterioration. So the symptoms worsen over time, and usually the patient lapses into a coma. The typical lifespan after a person is diagnosed with Cruetzfeldt-Jakob is about 6 or 7 months. Some people can survive up to 1 or 2 years, but it is usually a very quick progression. So it resembles Alzheimer's, although the progression is more rapid, so that's how you can differentiate. How does it affect cognition? There is memory loss, impaired executive functioning, and in the later stages, confusion, disorientation, and hallucinations are common. It affects communication. Some of the first things that happen are change in personality, which can affect their communication with their loved ones and people in their life. Later, they can develop dysarthria due to motor impairments, and also just general issues stemming from the decline in executive function. So we've talked about poor presupposition, a lack of filter, and working memory. This can all affect the person's communication. Other areas that it affects, it can result in difficult swallowing, so dysphagia, insomnia, blurred vision, psychiatric issues. They tend to develop early. Depression, anxiety, and withdrawal. Also motor ability, so myoclonus, sudden jerky movements, and even seizures can be seen later in the disease. Muscle stiffness, loss of balance, and poor gait. So here's just a progression of the symptoms. So the early symptoms, within the first few months, it's usually just psychiatric signs, so the withdrawal, anxiety, irritability, insomnia, and loss of interest. And then around 4 to 6 months, that's when the cognitive signs usually appear. So this is poor memory, difficult concentration, aggression, more dementia-like signs, and then also some motor signs appear, so dysarthria and gait disturbance. And then the late symptoms, they just continue to worsen. So there's disorientation, agitation, impaired coordination, myoclonus, incontinence. So it just gets worse and worse, but even the late symptoms is only 6 months in, so this is a very quickly progressing disease. So what is really happening? So it is called a transmissible spongiform encephalopathy. So there are infectious prions, which are proteins in the brain, and they, when they become infected, they start to self-replicate and create holes in the healthy neurons of the brain. So because they're self-replicating, then they spread the infection from neuron to neuron and just continue to progress rapidly. On the right-hand side over here, you can see why it's called spongiform, because there's these little holes, like almost like in a sponge. That's the result of these prions, destroying the neurons. And then it results in brain shrinkage and deterioration. So how can we help as speech pathologists? Like other dementias, we really want to maintain comfort and safety. So deciding appropriate diets for dysphagia, using implicit learning techniques for safety during activities of daily living. So whether that's eating or just mobility, like transitioning, things like that. We want to use implicit learning because their explicit learning will be deteriorating with their brain function. Also, we can help the patient communicate their wants and needs, providing simple AAC for dysarthria, like alphabet boards. Probably not more advanced AAC because it is a progressive disease and they most likely will not have this for long term. Also, we can do things like memory books depending on the progression of the disease. And finally, family education and counseling is very important. This can be tends to be sudden onset and then a really quickly progressing disease. So family members will need a lot of education on what to expect next in the staging, and also just counseling through this really difficult time. So yeah, that is basically what our role can be, and they just need our support. Here are the references that I have, and I hope you learned a lot. Thank you.